Hello, good afternoon, everybody. My name is Tamsin Rose, and I'm the Senior Fellow for Health at Friends of Europe think tank in Brussels. And I'm also the coordinator of the newly launched Africa-Europe Strategy Group, part of the Europe-Africa Foundation that was launched a few days ago in collaboration with Friends of Europe, the Mo Ibrahim Foundation, the One Foundation, and the African Climate Foundation. And this is looking to create a new partnership and dialogue between our two continents. Today, we're very excited to have the launch of the EU for Health Security in Africa, the partnership between the African CDC and the European CDC. An element which will build on health security in both continents. A perfect example of how mutual opportunity and mutual challenge will bring our new continents towards working together in a different way. So, without further ado, I would like now to pass the floor to the first person on behalf of the two partner organizations. And that will be, I'm going to give the floor to Ambassador Birgit Markussen, who will give us a short introduction to today's event and the specific partnership. Birgit, the floor is yours.
Thank you very much. Thank you for this opportunity. So let me, dear Excellencies, Commissioner El Fadil, Director General Koen Doens, who is also one of my bosses, heads of the Africa CDC and the European CDC, colleagues, ladies and gentlemen. It is with a very, very great and special pleasure that I'm welcoming you to the launching of this important joint initiative between our two specialized agencies, the European CDC and the African CDC. It is rewarding to see the discussions that started back in 2018 are bearing fruit with this joint action. As you know, this launching is happening in the midst of the fight against the COVID-19 pandemic, in which the two CDCs are playing their respective crucial roles in coordinating countries' emergency preparedness and response efforts. One of the things that this pandemic revealed is the crucial role of each agencies, and of course it reaffirms the conviction of the European Union and the African Union to strengthen these agencies and their multilateral action. We're delighted with this new action, and we expect that both continental CDCs will be able to work together to fight the current pandemic and hopefully also the future ones. This is also happening at the right moment when the two unions, in view of the next year's EU-AU summit, are discussing the further deepening of our partnership with strengthened emphasis on health security and collaboration on health systems in Africa. As you also witnessed today, we achieved an important milestone in the launching of the AU-EU Strategic Task Force on Health, and this will be an important framework to bring our long-term partnership to the next level with the necessary inputs from both European and African societies, such as think tanks, private sector, and academia. So I want to take this opportunity to commend the African Union Commission, the leadership of the Commissioner El Fadil, and the Africa CDCs in particular, colleagues in the European Commission and European CDC who participated in the formulation of this joint action. This action will be really key in demonstrating the long-term vision of the partnership between the two CDCs, and will make a very crucial contribution to the full operationalization of the Africa CDC and its structures around the African continent. Our delegation in Addis will remain, as always, available to facilitate the work and to contribute to the strategic discussions in the implementation of this action. So, final word, I wish you a very fruitful work, and we look forward to be working closely with all of you, and thank you very much for your attention.
Thank you, Birgitta. And as you say, this is the result of work that's been laid down for 2 years now, and it's coming to fruition. And in it itself is a multi-year relationship, part of the long-term commitment. I'd now like to pass the floor to the African Union Commissioner, Amira Mohamed El Fadil. She's going to share the viewpoint from the African Union and the perspective on this new agreement. Commissioner.
Thank you very much, moderator, and good afternoon, all dignitaries participating in this launching, and also to Ambassador Markison, head of the European Union delegation. I welcome all of you on behalf of the African Union Commission, and it's my pleasure also to give a few remarks at the opening of this meeting. Excellencies, the COVID-19 pandemic has demonstrated the need to address sustainable health, security, preparedness for outbreaks. As a continent, we recognize the socioeconomic impact that disease outbreaks have had on our people. We know that fighting COVID-19 and other disease outbreaks in Africa is not only about saving lives today, but about the future of the continent. It is about strengthening our health systems to better support preparedness and response to health emergencies in the future. And let me stop here and mention that we at the African Union Commission, we have produced a comprehensive document. It is on the socioeconomic impact of COVID-19. It is a document that's been initiated by the Social Affairs Department. Then we opened it for the inputs of the 8 departments of the African Union. Then we shared it with 11 of our partners here in Addis Ababa. Also, they gave their inputs, and we are taking this document to our STC in the first quarter or the second quarter of 2021. But for us, it's a very important document because it addresses in a holistic way the socioeconomic impact of COVID-19 in Africa. Excellencies, the European Union Center for Disease Prevention and Control, ECDC, and the Africa Center for Disease Control and Prevention, Africa CDC, are launching a new partnership to strengthen the capacity of Africa CDC to prepare for and respond to public health threats in Africa. And as I would like to join also Ambassador Bridget to say that this is part of our strategic partnership. The strategic partnership we have between the European Union Commission and the African Union Commission. And we are planning our high-level meeting in 1 or 2 days, replacing the expected summit. Unfortunately, because of this COVID-19, we are not able to have our usual summit between the African Union and the European Union. But the partnership is a strategic partnership, and this area is an area that we are expanding on. It's in the collaboration in the area of health issues. And this also, it was initiated, Ambassador, if you remember, first initiated into the college-to-college meeting, the one we had in process in 2018. Then again, health issues, even before this COVID-19, were the priority in our negotiations in the college-to-college meeting here physically in Addis Ababa before COVID-19. So what I see now, what we are doing, is we are going very fast on taking this partnership to a very practical area, launching today this initiative, and also the task force and the other initiatives in health. And I do appreciate very much this, the European Union taking this partnership very seriously with us in the African Union Commission. Excellencies, the European Union Commission is funding a 4-year project, EU for Health Security in Africa, between the 2 CDs, which will also facilitate harmonized surveillance and disease intelligence and support implementation of the public health workforce strategy of Africa CDC. And again, I would like to appreciate this financial support very much, and to commend you for coming quickly to our help, because this financial support is a timely, really a timely support for the Africa CDC. Excellencies, the goal of the project is to strengthen Africa CDC capacities in preparedness and response to health threats, facilitate harmonized surveillance and disease intelligence of outbreak-prone communicable diseases at continental level, and also to support the implementation of Africa CDC's public health workforce development strategy. The project is also an opportunity to be able to respond to the needs of member states in a more timely and efficient manner through the strengthening of their needs. This will also be achieved by strengthening the capacities of the regional collaborating centers, RCCs of Africa CDC, and as you know that we have 5 regional collaborating centers in 5 countries. We have in Zambia for the southern region. We have in Nigeria also for the western region. We have Egypt. We have for another region. We have Kenya for East Africa region, and also we have Gabon for Central Africa. And this project will be extended to support our RCCs. Excellencies, through this partnership also between the 2 specialized agencies of the European Union and the African Union, Africa CDC and Europe CDC, we will be able to exchange experiences and lessons learned from working with member states on the continental harmonized surveillance of infectious diseases, on data sharing and early detection of threats, as well as on preparedness and on risk assessment. Also, we can extend to the area of rapid response and emergency operations, and also on how to adapt these to their needs. Dear participants, we appreciate all the support from the European Union so far, and especially this project between the 2 CDCs, which is timely, as I said, and being a long-term partnership, we will go a long way also in supporting capacity building of our public health institutions, and also on building the capacity even of our health workers in Africa. In many African countries, we still have very fragile health systems, and this is an opportunity within these projects and with the support of the European Union Commission that we will manage to build the capacity of our member states. Excellencies, I would like to conclude by saying that we anticipate that this partnership will be the start of a more strengthened collaboration between Europe and Africa. And I would like also to take this opportunity to express our sincere gratitude for the continuous commitment of the European Union to advance Africa CDC capacities in preparedness and response to health threats and other public health interventions. I thank you very much again on behalf of the African Union Commission, and I look forward to the launching and also to working very closely together, the Africa CDC and the Europe CDC, and we would like also to extend this partnership in the area of vaccine. Bridget, we spoke about it, but it's a priority for us now. I believe Dr. John can shed some light on our challenges in vaccine acquisition for Africa. Thank you again.
Excellent.
Thank you very much, and back to you.
Thank you very much, Commissioner, for giving some of the context and the background and highlighting how strategically important this is for the future of the continent and of the partnership. I'd like now to share a brief video message from the European Commission Vice President, Margaritis Schinas. He will be sharing his views. Let's watch the video.
Dear colleagues and dear friends, it is a great pleasure to join you today to mark the launch of this much promising and much needed partnership between the European Center for Disease Prevention and Control and its Africa counterpart, CDC. Back in February, when together with my European Commission colleagues, we traveled to Addis Ababa for the African Union EU College to College meeting, the world could not yet fully grasp the extent of the unprecedented challenge we were faced with at the time. The coronavirus pandemic has since dramatically affected our way of life in every corner of the world, causing severe human suffering, with close to 1.5 million deaths and more than 63 million confirmed cases. Its socioeconomic consequences can still not be addressed to their full extent. The pandemic has also revealed more clearly than ever what we already knew from the Ebola, SARS, Zika, and cholera outbreaks of the past decade. Namely, that the health security, a long-standing objective in the cooperation between the African Union and the European Union, must indeed remain a global priority. It is essential to defend health as a global public good. In Europe, over the past months, we have taken unprecedented historic steps towards a European health union. In November, we adopted a new robust health security framework, which will allow us to deal with health crises more effectively. This includes a legislative proposal to strengthen the mandate of the European Centre for Diseases Prevention and Control. Our agency, the ECDC, plays an important role in crisis preparedness and response to infectious disease threats and outbreaks. With our proposal to extend and provide a new mandate, would allow the ECDC to issue stronger recommendations on measures to control outbreaks, to step up data collection, analysis, and modeling, to reinforce the prevention capacities for communicable diseases and issues such as antimicrobial resistance, vaccination, and biosecurity, and to build up the key competencies for health protection in EU member states through a new network of EU public health reference laboratories. Last but not least, we want the ECDC to have enhanced capacities in field response by mobilizing and deploying an EU health task force to assist local response in member states and third countries. With this proposal, we seek to reinforce the ECDC's contribution to the EU's overall international cooperation in the area of health security, preparedness, and response. Through our external action, we pursue a rights-based and universal approach to health in accordance with the values that public health systems within the EU are built on. In Europe, Africa, and the rest of the world, our investments in health are investments in prosperity, social and financial protection, security, and importantly, well-being. The pandemic has increased the urgency of working together. From early on, the European Union and its member states acted together as Team Europe to support partner countries on three fronts. First, on the immediate, urgent response to the health crisis. Secondly, on strengthening healthcare systems capacity, research, and innovation to fight the virus. And thirdly, mitigating the socioeconomic effects of the pandemic. To this end, we have mobilized 38.5 billion euros, both as EU institutions and EU member states. We are proud to have spearheaded a global response, catalyzing partnerships such as the Access to COVID-19 Tools Accelerator to ensure equitable access to diagnostics, therapeutics, and vaccines. And we are proud to have contributed significantly to the COVAX facility, providing 100 million euros in grant support and 400 million euros in guaranteed loans through the European Investment Bank. Dear friends, Africa has also been resolutely tackling the pandemic. The African Union has been leading the continental response to COVID with key strategies and platforms rapidly established. The Africa Joint Continental Strategy for COVID-19, the Partnership to Accelerate COVID-19 Testing, the Africa Medical Supplies Platform, and the Consortium of COVID-19 Vaccine Clinical Trials. They all demonstrated the leadership of the African Union and its African Centers for Disease Prevention and Control, and I applaud the African Union's stewardship and strong coordination role. The launch of today's partnership between the European Center of Disease Prevention and Control and the Africa CDC is a crucial step to further strengthen our common efforts. I'm indeed very pleased that EU funding enables a long-term collaboration between these two agencies specialized in health security to the benefit of both the people of the African Union and the EU member states. Working together, you can make strides in key matters of preparedness, from harmonized surveillance systems to disease intelligence and health workforce training. Your joint work can immensely help countries to strengthen their capacities to prevent, detect, and respond to outbreaks, epidemics, and pandemics. With these thoughts, I wish every success to the ECDC for Africa CDC initiative. We thank you, and we count on you more than ever.
Excellent. Thank you very much. And again, very interesting to hear the importance of the political support, the financial support, and the institutional support that has gone into this partnership that has been built up over the last 2 years and as part of a long-term engagement. Just to cement that, I'd like to pass the floor briefly to the European Commission, to the Directorate General for Development, Mr. Koen, briefly just to give us an additional few comments on this.
Well, thank you very much. And indeed, I will try to be brief because we've been listening already to very substantial contributions, and I'm not sure it's good for our health if I add to that. But I nevertheless want to say how glad I am of what is happening today, the launch of this partnership between the ECDC and the ECDC. And I think that's what Commissioner Dr. Fadil has said, what Vice President Margarita Schinas has said covers basically it all. And I would just want to maybe add three key messages. The first one is about the importance of human development. And I think that since COVID-19 spread globally in March, our health systems have really been the first in line of defense. And they have facilitated the emergency response. They have mitigated the damage done by the virus. And in many cases, they've done that through measures that reduce the disease transmission, such as surveillance, early warning, control tracing, testing strategies, or treatments. And I think that as our two specialized agencies have been at the forefront of these efforts, and they really need both of them to be lauded, and it's great to see how they come together. It shows, in my view, two things. First of all, is that whatever the amount of money we spend to put in place those measures, they will easily pass any cost-benefit test. And two, that the most important economic policy for a full recovery is probably indeed to end the virus itself. And so I would really like to congratulate Dr. Amon and Dr. Nkenga Song for being at the center of Europe's and of Africa's dynamic response to overcome COVID-19. My second message is about, let's say, the importance of international cooperation. A global threat such as the one we're confronting today always requires a global response. And I think it means that all countries have to work together through cooperative systems. The EU has always been a strong advocate of multilateralism. We believe in multilateral partnerships to overcome this pandemic and to bounce back through a global recovery that is sustainable and that makes us more resilient. And I think that the past few days have brought some of the best news of COVID-19, evidence that the vaccines currently under development will be available within the next few months. The EU is strongly pushing in that angle for universal and equitable access. And that's why we are investing heavily, not just in the development of the vaccines, the diagnostics and the treatments through our Team Europe response, but also in the COVAX mechanism to ensure that the vaccine is distributed to all. So
Great.
Human development, international partnerships, and the third and final message is then that the partnership today we launch embraces precisely those 2 points, human development and international partnerships. And I'm really glad to see how our agencies together will do something through partnership that probably will be bigger than the sum of its parts. Great to be part of this exercise, great to be able to contribute. Thank you very much.
Thank you very much. And now let me pass over to the directors of the 2 agencies themselves to give us their insight, because of course they're the ones who will be taking forward this initiative. And I'll start by inviting Dr. John Ngenkason from the African CDC to just give us a few words to tell us about how this works for your organization.
So thank you. Let me first of all start by really truly appreciating the partnership between the European CDC and Africa CDC. I think we started this dialogue and conversation in 2018, and I'm truly amazed to see how much it has evolved. And when we started in 2018, we hardly knew that we would be faced with such a pandemic. We always knew for sure that pandemics are here, that we live in an era of pandemics, but we just didn't know how soon this one was going to face us. So I think in the spirit of true global cooperation to ensure health security of our 2 people, this initiative today, this partnership that we are cementing today goes a long way to ensure that we begin to look at health security from a very broad base, and that will contribute to the overall global health architecture of the world. We've learned a lot from this pandemic, that we are more connected than we thought, that we are more vulnerable than we thought, and that we have more inequities than we thought. So I think it's very clear that it's only through the appropriate and trusted partnerships that are underpinned by strong cooperation, strong collaboration, and strong coordination that will be able to truly implement the health security agenda of our 2 people. Let me just reflect on 3 things. One is that we need truly to have a new public health order, which for the continent, which we have preached and published extensively, which hinges on the very core elements of the partnership we are here to sign. That is workforce development, strengthening of a national public health institutes, and begin to focus on local manufacturing of diagnostics, pharmaceuticals, and clinical trials. It is through this spirit that will contribute into the new architecture that will ensure that the world is better prepared, starting at a global level where the World Health Organization is empowered and strengthened, but then at a regional level where structures like the Africa CDC, the European CDC are not only strengthened, but they are empowered. So I'm extremely encouraged to hear that the European CDC will be further empowered to do the things that it is supposed to do to ensure the security of that continent, which will indirectly and directly also have that implication across the continent of Africa. We for ourselves are also, as Africa CDC, be looking forward to an strengthened and empowered Africa CDC that will contribute to that whole spirit of a strengthened global architecture. And lastly, the focus should be at a national level. Global health security begins at the national level, and we really take our agenda to strengthen our national public health institutions and the networks as a cornerstone for our overall security. So I truly look forward to implementing this key milestone that we are here today to inaugurate. Thank you.
Thank you very much. And also you again highlighted that the pandemic has been a painful but important, timely lesson. And it came after the strategic decision that you'd made in 2018 to work together, but it gave you already a foundation to build on and accelerate change. Let me now pass over to Andrea Ammon, the Director of the European Centre for Disease Control. Andrea.
Thank you. Dear colleagues, as you have heard, we are launching this collaboration in the midst of a pandemic. And while it's still too early to have all the lessons learned, one of them points to the fundamental importance of working together in close collaboration between countries and continents and international organizations and agencies. As you also have heard, we have started 2 years ago in this, and that was when you, John, and Benjamin came to visit ECDC, and we discussed that there are a number of topics of mutual interest and benefit. So our teams started then working on concrete proposals, and when I visited you 1 year later in Addis Ababa, there was already a well-defined framework. At this point, I also would like to thank the colleagues in DG DEFCO for their continuous support along this way and supporting us in taking away the stones on our path to this partnership. And for trusting us for the implementation and for the funding. You have heard that the partnership will cover the major public health functions because pandemics, epidemics, crises will continue to challenge us. The fact is that both of our agencies have been born out of crisis. SARS in 2003 for ECDC, the Ebola in 2014-15 for the Africa CDC. Now, both of our agencies have already accumulated really a valuable knowledge, expertise, and lessons learned, and on how to act and prepare for cross-border health threats during and after the crisis. So sharing our experience and learning from each other is really a valuable asset in advancing preparedness for public health emergency in both continents. So I am looking forward to building this long-term and sustainable partnership between our two agencies with the ambition to enhance health security both in Africa and in the EU. I think I can speak for both of us, John, that both agencies are committed to make this project happen for the benefit of the people in Africa and in the EU. So let's get to work. Thank you.
Thank you very much, Andrea, and reminding us again that both agencies were created as a response to a crisis. So it's no surprise that they see an opportunity to strengthen and deepen their work as we are in the middle of yet another crisis, because that's one thing we can guarantee. The future will bring us more health crises, particularly coming from communicable diseases, possibly zoonosis. So it makes sense not to wait for a quiet time, but to keep going straight forward. Let me now pass to two colleagues from both the ECDC and the ACDC who will briefly give us some of the details of this partnership that was outlined by the two directors. And I'd like to share Marit Koki and Benjamin Judalbay from both the ACDC and the ECDC will do a joint presentation to share with us what's in this partnership. So let me pass over to you, colleagues, Marit and Benjamin.
Thank you. Marit will start.
Marit, go ahead.
So thank you, Tamsin, and good afternoon to all participants, ladies and gentlemen. I will share my screen and the presentation. So I indeed, in few slides, we will show you the content of the partnership. And before that, I think I would like to first of all thank all the technical colleagues from both agencies for providing the inputs for the content of this proposal or for this initiative. Few slides regarding agencies, ECDC and Africa CDC. As you have heard already, the outbreaks have facilitated our establishment, and that happened for ECDC in 2003, and in 2005 we became operational. And we are really working on communicable diseases and to engage in Europe-wide surveillance of communicable diseases, monitoring of health threats, and preparing risk assessments for the use of risk managers. And today we have some 300 staff from almost all EU member states and a budget around 60 million euros. And we work with all EU member states and also beyond. The legal framework is not very vast, but our founding regulation and the decision on cross-border health threats. And you heard already that in fact, these both legal frameworks are now under a review due to lessons learned from the COVID pandemic. So with this, I will pass to Benjamin and his words regarding Africa CDC.
Thank you very much, Marit. Let me join you and join my voice to you to thank all the colleagues who have contributed tremendously to this project. So next slide, I'm going to take you through Africa CDC. The decision to establish Africa Centers for Disease Control and Prevention was made by the state and government in Abuja, Nigeria in 2013. The Ebola crisis in West Africa just fast-tracked the establishment of Africa CDC. Africa CDC was officially launched on 21st January 2017 here in Addis Ababa. And from the left of the screen, you can see all the state and government who are present. And here it was the former head of the Union then, and the chairperson, the former chairperson of the African Union Commission, and also Commission of Social Affairs, former Commissioner of Social Affairs. Next slide. So the mission is a safer, healthier, and prosperous Africa, and the mission is to strengthen Africa public health institutions, capacities, capabilities, and partnership to detect and respond quickly and effectively to disease threats and outbreaks based on science, policy, and data-driven interventions and programs. Next slide. Africa CDC has a strategic plan with 5 pillars, and the strategic plan is from 2017 to 2021. The first pillar is on disease surveillance and intelligence. The second one is on emergency preparedness and response. The third one is on laboratory systems and network, and the information system is the fourth one. And the last one is the National Public Health Institute and the research. And the foundations, we have finance, leadership, partnership, governance, and it is under this partnership that today we are meeting here. Next. This is the model, the operating model of the Africa CDC. We have the headquarters here at the African Union Commission in Addis Ababa, and we have 5 regional collaborating centers, one for each region of this continent, and under each regional collaborating center, we have network of national public health institute, and roughly today we have 24 formally established national public health institute on the continent. Next. This is just the geographical representation of what I just presented. Next. We have key partners, and this is just to name few of them. You have WHO has one. We have US CDC, China CDC, World Bank, Germany, of course, the European Union and the European CDC. So there are many who are supporting the work that we are doing in terms of health security on the continent. Next slide. Over to you.
Thank you very much. Now to the project itself. And here you see that, in fact, you don't have to see the text, but just to show you the timeline from 2018 until today and the events, what it has taken for us to come here. The overall aim of this action is to contribute to the health security and in Africa by sharing EU practices and strengthening the capacities in preparedness, surveillance, and response to health threats posed by communicable diseases. The funding authority, as we have heard, is DG DevCo through European Development Fund. And this project to start the building up the long-term sustainable partnership is until 2024. And as you see, the 10 million budget is divided between two of us. And I think it's important also to mention that this action is not a mechanism to support purely the COVID-19 response. As you have heard already, there are many other ways for doing that. For ECDC, this is quite distinct from previous externally funded projects. We are entering a totally new continent. This is the first intention of our agency to support EU's development cooperation policy. And as you have heard, the African Union, European Union partnership is strategically important, and we are then, when building institutional capacities and exchanging experiences as technical agencies, we implement those strategic views. And the content, Benjamin.
Thank you so much, Marit. We have the content is packed in 4 work package, and the results are the work package 1 is on the preparedness, outbreak response, coordinated and functioning EOCs, emergency operating centers, and the expected result is increased capacity of the Africa CDC and its regional collaborating centers to support national CDCs, laboratories, and health workforce in preparedness, outbreak response, and coordinated emergency operations. The work package 2 is on harmonized surveillance systems, data management, and epidemic intelligence. And the expected result is a pilot model with lessons learned documented for harmonized surveillance and communicable diseases and early warning, harnessing existing regional integrated surveillance and laboratory network. Over to you for the last 2 packages.
So basically the third package is about the public health workforce development and capacity building. And of course, it already captures the 2 previous work packages with the result of establishment of a sustainable African-based public health workforce development program in epidemiology, and it would be promoted by the Africa CDC. And the last work package is the management of the entire action. And what is important is that the first year of this action is planned to be an inception phase for diagnostics and gap analysis in order to plan activities which would be most suitable and add most value to the Africa CDC and its regional collaborating centers. And then the following years would be the prioritized action based on the results of this first year. But there might be challenges and opportunities, Benjamin.
Yes, as you all know, COVID crisis is an opportunity and is also a challenge. We are going through, we have the legal framework for continental health security in Africa, and we have some differences and similarity in given mandate to the European and African technical agencies for disease prevention and control. For instance, the European doesn't have the mandate for, remind me again, Marit?
We are not risk managers.
Yes, you are not risk manager, but we are we as Africa CDC, we are also risk manager. So that is a fundamental difference between the two institutions. And the donor coordination and magnitude of partners, including the division of labor between the Africa CDC and WHO. As you all know, WHO in Africa is divided into two. We have 47 countries in the WHO Afro, and we have the remaining of the countries, especially in North Africa and some countries in West Africa, belonging to the EMRO region. And we have also the administrative capacity and available human resource at Africa CDC and its RCCs. Yes, when we started this project, the capacity was very low, but we are gradually seeing more and more people coming on board. So these challenges is being overcome. And we welcome that this project also will come to strengthen the capacity in terms of human resource of the Africa CDC. The European CDC works in an environment defined by the EU legislation and largely relies on the networks of the competent authorities in the EU countries. And here also we work we rely on the network of the National Public Health Institute, who are also directly linked to the regional collaborative centers. And the potential benefit for Africa CDC from the Europe unique expertise, we know that Europe also brings 27 member states together in an iterative process together for coordination and networking, thus building trust and transparency. And we have a lot to learn from the European CDC in implementing this project together. Thank you very much.
Thank you.
Excellent. Thank you very much for giving us the details, both of historically how this was developed and the core areas that you're going to be working on. And as a reminder that this is not the COVID response package, which is entirely separate, that was referred to by the Commissioner Shinas in his video. It's part of the long-term development plan for the two organizations. So now that we've come to the end of explaining the context and the content, I think now is the moment to seal the deal through the signing. So I'm delighted to be able to invite the two directors to prepare themselves. And of course, this is COVID times, so it's going to be done simultaneously, but remotely in two different places. So Dr. John Nkengasong is going to be signing in Addis on behalf of the ECDC. And let's watch him sign this multi-year agreement that breaks new ground in the Africa-Europe relationship between the two CDCs. Please go ahead. Excellent. So it's now about to be signed. And once the papers have been signed, of course, that means that the work can start. All the preparation that's been happening for the last 2 years now comes to fruition. So let's see, this is the signed document from Addis. Thank you very much. And of course, Dr. Nkengasong will be signing just one side, and it will then be sent by post to Europe, and it will be signed on the other side by Andrea Emmon. And in the same way, the document she is signing will be sent to Addis for co-signature. Thank you very much. We can see that the document is signed and the ECDC is now formally committed to this multi-year program. Congratulations. Thank you. Now let's turn to Andrea. It's your turn with pen at the ready, I can see. Let's seal the deal from the European side and sign off on this big project. And of course, once this happens, the collaborators, the teams will start working. Excellent. Thank you. There we have it. The documents are signed, the project can start, and I'd like to close this part of the ceremony, which was the first part where we were talking to you, the audience. And now for our remaining 15 minutes or so, I'd like to have some input from the audience to the two directors, the ECDC. And I believe we're going to start with a question. If you'd like to raise your hand in the chat or send a question, we'd be delighted to take them. First of all, we have a question from Augustine. Augustine, if you would like to unmute yourself and with your camera on, please briefly pose your question.
Yes, thank you very much for this timely initiative. So my question is to either of the panelists. I wanted to know how do you plan to align, complement other key Africa-EU health initiatives, such as the European and Developing Countries Clinical Trials Partnership, which is the flagship initiative of EU-Africa Cooperation on Health Research, or future initiatives already planned by the Commission, such as the Health Emergency Response Authority, the EU BARDA. Thank you very much.
Okay, thank you very much. The two directors, would you like to answer this? Andrea, I see your hand.
Yes, Andrea, please.
Yeah, thank you very much for the question. I mean, that is part of the inception phase that Marit and Benjamin mentioned, where we map all the different stakeholders that might work in the field or that working in the field, and how we make sure that there is synergy and no duplication with the work. Now, this new EU agency, HERA, as it is called, the Health Emergency Response Authority, is not so, I mean, it may be conceived, but the legal proposal is not yet there. So we will also make sure that there is coordination and alignment and no duplication.
Excellent, thank you. I'm aware of the limitations of time and we have lots of people who'd like to come in. So I'm going to bring in our next question from Dr. Sarah Wamala Anderson, who has a question, and either John or Andrea could answer that. Sarah, would you like to unmute yourself? And of course, Sarah is one of the members of the new Africa-Europe strategy group on health that was just launched earlier this morning. Sarah, please go ahead.
Thank you very much. This is wonderful, and congratulations to everyone who has been working hard for this. My question or reflection is related to how do we tap on the digital solutions and the advantage we have for that to build up the new ecosystem of health, and how we ensure more access of health services and health promoting activities through digitalization. And also, of course, related to capacity building, leadership and governance.
Excellent, thank you. Could I pass this to John to answer? Because one of the elements that came up in our health strategy group this morning was just how fast Africa is digitalizing. It's a young population, it's digital savvy, it's leapfrogging the older continents in its adoption. So maybe could I invite you to comment on this, how you see this new program supporting the work in digital or using digital to implement what you're doing?
I think our disease intelligence platform will be really supported tremendously by digitization. We've learned over the last probably 1 year now the power of digitization. We always talked about it, but COVID, I believe, has propelled us to begin to use digitization in a manner that we're still talking about it, about the fourth industrial revolution. I think it is here today. And there's absolutely a central role for digitization to play in this whole arrangement, be it in disease intelligence, networking a continent of 1.2 billion people, and bringing our national public health institutes together. So we are very optimistic that that will be the pathway going forward.
Excellent, thank you. Let me bring in the next person from the audience, John Amasi, who is also a member of our strategy work this morning, who came in. Would you like to add a comment or ask a question? John.
No, thank you very much for this. And I want to extend warm congratulations to the Africa CDC led by Dr. Kingasong and the ECDC for this really momentous occasion. Of course, the inception of the Africa CDC has been more than timely, especially in these COVID days. And we have seen across the continent the leadership that the Africa CDC has brought, particularly in making possible researchers and policymakers and others across the continent to make their contributions to address COVID. We've seen collaboration at unprecedented levels across the continent between academia, industry, and so on. Now, what I'd like to ask is, or what I'd like to find out is how moving forward with the Africa CDC and the European CDC, issues around capacity building very specifically towards the conduct of research, especially two specific areas, biomedical research and socio-anthropological research. To address some of the socio-anthropological research, to address some of the narratives that have persisted in social sciences and in medical sociology over the years, which we're only recognizing now have some serious flaws that need to be addressed through proper socio-anthropological research. And then the biomedical research, a lot of capacity across the continent, but still significant limitations when it comes to rather advanced kinds of biomedicine, such as have allowed members of the EU to very quickly address issues of vaccine development and production, and how we can ensure that similar capacity is built across the African subcontinent. So that will be my question. Thank you.
Okay, John, let me now pass this over to Andrea and John, who would like to respond on this. You know, focusing, obviously recognizing the remit of the ECDC is limited. It doesn't cover all issues of health, but this area of biomedical research, in your partnership, you're committed to increasing the capacity and skills and strengthening the public health workforce. How would you like to pick up on that element that was raised around the strength of the biomedical research to allow the kind of medical breakthroughs that would be needed? John, Andrea, yes, let's start with you and then I'll come to John. Andrea, go ahead.
No, I think the research is not specifically addressed with the partnership, but we have capacity building and training work package where we basically train and future researchers, future public health experts, and we are really in the process here in Europe to see what are the competencies that are necessary in order that the fellows that we train through this program can face the challenges in the future. So it will be addressed more indirectly.
Yes. Okay, John.
No, absolutely. I mean, I agree with Andrea, but let me just respond to that question more broadly, that as you heard me, or perhaps in my introductory remarks, we talked about a new public health order that speaks to the specific need to strengthen our ability to locally manufacture vaccines. No way you're going to do that without investing in the research capacity upfront. So we look forward to, first of all, strengthening our collaboration with EDCTP, which is already very strong. We need to tap on that very strongly because there's a lot of capacity on the continent. What needs to be done and done in a very profound and deliberate manner is to harness those capacities and begin to look very focusedly around knowledge management and gaps where we strengthen that. Then we can create new ones. Then the second part of that is that, as the saying goes, you don't dig your wells when you are thirsty. We have to have ongoing networks of centers of excellence on the continent that will build on what already exists on the continent to advance clinical research and as well as about behavioral research. We absolutely know that we cannot win a pandemic or any outbreak without combining biomedical intervention and socio-behavioral research, which has been a gap. And I think those are all components that will be dealt with, some of it within the context of this collaboration, but some of it outside the context of this collaboration.
Excellent. Thank you very much to John and Andrea for taking those questions. We're coming now towards the end of our time, and it's been a very exciting moment to watch the signature of this big project. And I like that last image you gave us there, John, which is that you don't dig wells when you're thirsty. This is a lesson that's written into the DNA of both agencies, because you were both founded after a crisis on the understanding that you needed to dig the wells in preparation for what's coming. And here, as the world is challenged dealing with the response to COVID, you are laying the foundations for building up the strength, the capacity, and the knowledge networks that would make both Europe and Africa more resilient for the future. Because and I believe it was Commissioner El Fadil who said that we are more connected, we are more vulnerable than we thought, and we need to find a way forward. And both European and African Union commissioners talked about the need for understanding the impact on our societies. If we don't have a healthy population, our societies and our economies, our well-being is deeply affected. And this is a threat under communicable disease, which of course is the core focus of both the ECDC and the ACDC. But more broadly, we need to invest in stronger health systems with universal coverage. We need to build up our networks of health workforce. We need to build also the regulatory environment so we can both manufacture, research, and trust in our medical devices, our vaccines, and our medicines. And these are areas for very rich cross-fertilization between the two agencies and indeed the two continents. So I would like to thank everyone for watching us today and taking part in the official signing and launch of this big partnership. Today is the Health Day in the EU Africa Days that we at Friends of Europe are holding all week, linked to the launch of the Africa Europe Foundation, which is seeking to create a new narrative and new dynamism for the relationship between the two countries. If you go to the Friends of Europe website, you will find information about forthcoming events, including tomorrow, where we will have a focus on digital to see how that could move our societies forward. Thank you to our colleagues at the ECDC and the ACDC for allowing us to host this event on your behalf. Congratulations on the hard work that went in so far. And I know this is only the beginning of a long path for you. So congratulations. And in the health strategy group of the Africa Europe Foundation, we look forward to engaging with you and exchanging in the coming years. Thank you all for watching at home. Goodbye, stay safe, wear a mask and wash your hands. Goodbye.
Thank you. Bye-bye. Yeah.
Thank you. Wonderful. Thank you. Bye-bye.
Thank you very much and congratulations.